Hello everybody, welcome to Dr. Chen's Minor Ailments Forum today. So the topic that I'm going to talk about is cervical cancer screening. Now, why have I chosen this topic? It's because several days ago when I was at work, I received a bunch of leaflets regarding promotion of cervical cancer screening. And I just realized that we are not very good at uptaking this screening very well, especially in my area. Sometimes I have to talk to my patient about the screening and they said, well, actually, I feel fine, so I don't see why I have to have it. And actually, I'm really scared of having it, so I don't think I'll ever have it. Even though they know that deep down inside that cervical cancer is quite common and it affects loads of people, especially young women. But because of either they don't know what is involved or don't know how serious cervical cancer is, they just kind of dismiss the screening. So I thought I'll just use the opportunity to explain to you the importance of cervical cancer screening and also how it's actually done. So let's go back a little bit and talk about cervical cancer. In this country, this condition is very common, especially affecting young women between the age of 25 to around 45. That's why we have a screening in place. So we have different kind of screening programs for different age. So this cervical cancer can happen to anyone, any woman at any age, but it's less common in patient who's less than 25 and more common in people from age 30 above to maybe 45 years old. So the screening process is like this. If you are from 25 years old onwards, then you might have a 3-yearly screening. So after the age of 45 to kind of 60, you'll have a screen every 5 years. We don't normally screen people whose age over 65 unless you've never had one from the age of 50 or recently you had abnormal results that need to be followed up. So give you some statistics about cervical cancer in this country. Back in 2012, Cancer Research UK actually made a study to see how prevalent this condition is, and they found that in 2012 alone, around 3,044 people had a new diagnosis of cervical cancer, and the death rate was actually 919 in 2012. So I think that's quite shocking in this kind of day and age, especially. It was actually more than half of the people affected, or more than half of the people who died from, who got a new diagnosis of cervical cancer are young women. So that's why I'm trying to say that the screening is extremely important. So if you've never had a smear before, let me just tell you what is entailed. If you're from 25 years onward, you should receive a letter from the screening department saying, hey, you're 25 and above, you probably need a screen. And on the letter, it will tell you where to go and where you can get your screening done. Most of the people like to get it done in GP practices because it's easy, they know where to go, and the nurses there are very good at taking smears. But for other reasons, for example, if you work a lot and during the daytime you can't take time off or not many hours off anyway, you might want to get it done in a well women clinic or a sexual health clinic. They also do screening as well. So first of all, you need to book an appointment, and the appointment generally shouldn't last more than 5 to 10 minutes, and the procedure definitely doesn't take more than 5 minutes to do. So on the day, it's recommended that you wear some loose clothing and stuff that is easily taken off. You may want to wear a dress or a skirt or maybe some loose trousers. So when you see the nurse will ask you to undress the bottom half, and she'll give you something to cover up, and she'll use a device called speculum, which is like a prong to open up the area so we can see the cervix properly. And she'll have a look and then use a rubber brush to kind of brush some of the cells off from the cervix, and then put it into a special liquid, and we send it off for testing. The result generally take about 2 weeks to come back, and when it comes back, it'll inform you via a letter, letting you know whether the cells were normal or abnormal. Now, number one thing they'll do is to look at the cells to see are there any changes. If there's no changes, then that's fine. Then nothing, you don't need to do anything, and you just have to have a rescreen, maybe 3 to 5 years, depends on your age. Let's say the sample came back saying it's inadequate, i.e. it's not enough cells in the sample, or the cells weren't clear under the microscope, or you had an infection or some sort. You might need to be treated first and then get a rescreen again in 3 months' time and see if the result is normal. And the third kind of scenario would be, it's actually said the cells are abnormal. Now, please bear in mind that if the result comes back as abnormal, it doesn't mean that you've got cancer. It just means that the cells didn't look quite right. Sometimes, especially in younger women, the cells can change all the time. So when you repeat it again in 3 to 6 months' time, it's all go back to normal. But this is how we detect abnormal cells if it's persistent. So if it comes back as an abnormal cell, they will look at the category to see whether it's mildly abnormal or moderate or severe. So in mild situation, when it's slightly abnormal, they would do an extra test called HPV testing. Now, HPV actually stands for human papillovirus. Now, it's a bunch of viruses. It's not just one virus. And some type of these viruses can actually cause cervical cancer, especially type 16 and 18. So if your cells are slightly abnormal, they'll test for HPV to see that if you are infected with this virus. If you are tested positive having HPV, then you'll be sent to the hospital to have a test or have a procedure called colposcopy, which is very similar to having a smear. You still have a speculum in place and your cervix exposed, but the doctor will use a camera as well to have a closer look and might take a biopsy to test and see if the cells are normal or not, because it's more accurate than doing a smear. So if it comes back moderate, then they will send you to colposcopy, and same as if it's severely changed, and they will send you for colposcopy as well. So bottom line of this is, cervical cancer screening is extremely important, and it's only a procedure that takes no more than 5 minutes. Although it's a bit strange, it's a little bit uncomfortable, but it's only going to last a few seconds, and that could potentially save your life. If there was any cell changes, then we can get it sorted out and treated straight away, and that wouldn't even be led into cervical cancer down the line. So if you want to know more information, I've recently found out a website that's quite useful. It's called Joe's Cervical Cancer Trust. It's a relatively new trust, I think. It was formed probably in 2013, maybe a bit earlier. And they are an independent charity that's based in London to help with anything about cervical cancer, whether you're affected by it or your family members, or if you need more information. So you can go online and have a look at this website and get support. And if you've got further queries, please don't hesitate to contact your GPs for more information. So I hope that the video is informative for you, and it's important that you go for your screening. Okay, so until next time, take care of yourself. Bye bye.